My youngest is here at the high school. We were in Fort Lauderdale with the airport shooting. We were on the roof of the airport running from what was said to be gunfire, and the airport was on lockdown. Coming home from that, I knew that we were going to need some help.
We decided to embark on this adventure of opening up a school-based health center. I always felt that the mental health services would be the backbone of the clinic, just because I was able to see the needs that were not being met in the community.
Not all the places that you take the kids to are compatible with an 8 to 5 work schedule. There's been a time in my life where it would have been nearly impossible.
I'm a parent peer specialist. I'm there for support. If the parent gives the okay, I usually introduce myself. Let's go and have coffee. Or maybe we can go to the library. You can always rent one of those rooms at the library. We can get to know each other and have a dialogue to help them find resources to help their students, maybe a psychiatrist or psychologist.
For our pregnant and or parenting students, I thought that the mental health piece, almost all of our students have either gone through a trauma or are currently experiencing trauma, and so the mental health piece is huge.
I saw young people that would have had some help earlier in life, maybe wouldn't be in our correctional system.
The School-Based Diversion Project is essentially in place to try to navigate students out of the juvenile justice system.
Let's divert them into some kind of mental health educational program. Let's not wait till they get into prison. I have a positive view of the future because we are taking more of a proactive approach.
I don't get the calls anymore that cry for help of, I can't get this child in to see a mental health provider.
Increased attendance, increased graduation rates.
It's very comforting to me. Sometimes you just feel like I'm really tackling the world with my child, kind of alone sometimes, and I don't feel that way here.
There's got to be a way to continue to keep the positive part of what we're doing.
There's always a lingering fear of the bottom line.
Having worked with grants over the years, they come and they go.
Funding is vital. If we can catch them while they're young in the school setting, it will have an impact on our community health and wellness for years to come.